Hi, beautiful people. How are ya? I hope you're having a great day. Well, it's actually just a couple hours later from when I did the video with my grandson, Charlie. But my husband and Charlie are out taking Tesla for a walk, and I thought, I better hurry up and get this video recorded too, because I had this script ready when Charlie said, Hey, I'd do a video with you. So I had to come up with a plan real quick because I thought that would be fun. Izervay is a new treatment for geographic atrophy, GA. I could choose to get the Izervay treatment once a month or less often than that. At least that's what I think. And I figure I'll discuss that with my doctor when I see him in May. There's an interesting UK study on this topic in this way, and patients choosing how often to get it done. And I've linked that below. Age-related macular degeneration, or AMD, affects people over the age of 50 typically. And even though you can get fibromyalgia at any age, it typically affects people at middle age, which is between 45 and 65 years old. So a conversation about AMD is appropriate for us because it's within the geographic population of fibromyalgia patients that watch my videos. Well, usually, there are some of you who are younger and some who are older, and that's wonderful. So this information is for you too. Today is about what I've been learning about AMD and GA, age-related macular degeneration and geographic atrophy. I'll explain those terms, and I'll explain what parts of the eye is affected by geographic atrophy and what it is. So here we go. The macula is the part of your eye that processes what you see directly in front of you, your central vision. It's part of your retina and is key to our vision. The macula is the round area at the center of your retina, at the back of your eyeball. It's yellow in color. The macula lets you see small details right in front of you and focuses on very specific aspects of what you're looking at, like the rest of your retina. The macula converts light into a signal that your brain can process and understand. Without a macula or with a damaged one, your eye will still take in light, but your vision will be blurry and lack details. The macula accounts for almost 10% of the entire visual field, so it has a major impact on visual function. Our retina consists of layers of neural tissue that line the back part of the eye that sends information from the eyes to the brain. If something affects the macula, like in age-related macular degeneration or AMD, your vision can get worse. The macula is less than 1/4 inch wide or 5 millimeters. It's a round yellow spot that has a slight oval shape. It's made up of photoreceptor cells. Rod photoreceptors process black and white light and help you see at night or in dim light. Cones process color and make up most of our usual vision. There's a high concentration of cones in the eye. Most of these cells work together to give a clear, accurate picture of what you're seeing. The fovea is at the center of the macula and allows for the sharpest visual acuity. A large number of cones are located there. Age-related macular degeneration is the leading cause of vision loss in people over age 60 in the United States. Drusen are yellow deposits in the retina. Dry AMD progresses very slowly. There are 3 stages. The yellow deposits, drusen, may enlarge, and pigmentary changes may develop, along with tissue atrophy and mild scarring by the 3rd stage, late AMD or geographic atrophy. Geographic atrophy occurs at the end stages of AMD. At this stage of the disease, there is a complete loss of photoreceptors, which leads to irreversible vision loss. I'm not quite there yet. I'm in the late stage, but it's a process. Geographic atrophy is an advanced form of age-related macular degeneration. GA can occur late in the progression of dry AMD, like in my case, but can also occur after wet AMD has developed and after the use of anti-VEGF injections, the treatment for wet AMD that stops the inflammation. And patients with GA can also develop wet AMD. No matter what, GA causes irreversible vision loss. So geographic atrophy is called that because images of the retina, areas of dead cells called atrophy, resemble a map, like geography, hence the name geographic atrophy. The degeneration or loss of tissues causes a loss of central vision. Basically, there's a blind area in the center of vision. This is the area of vision that is responsible for detailed and color vision. The person loses the ability to read, recognize people's faces, and drive. AMD is a disease that damages photoreceptors, light-sensing nerve cells in the retina. In the center of the eye is the macula. The damage begins there, which causes blurring of the central focused vision, making it harder to do those things we cherish and give us independence. But we learn to overcome those challenges, just like everything else in life. There are 2 types of AMD, dry and wet. The dry is the most common, and approximately 10 to 15% of AMD patients will develop the wet form. Drusen are those small yellow-white deposits, as I mentioned, that become visible on ophthalmology scopes as white spots in the retina, both in the macular area as in retinal periphery. Early dry AMD will have medium-sized drusen deposits around the macula. You won't have any symptoms, most likely, and will be unaware that AMD is occurring. I had no idea. In intermediate dry AMD, large drusen or multiple medium-sized drusen are present, or there are pigment changes called retinal pigment epithelium disturbances. And in some people, they won't even experience any symptoms. But others, however, may notice mild symptoms like mild blurriness in their central vision or trouble seeing in low lighting. And that's the stage I think I've been in for a few years, but I've been told I still had mild, so it's confusing. If large drusen are present in both eyes, the chances of developing late-stage AMD increases to 26% from one eye at 6.3%. And approximately 37% of people at this stage with medium drusen in one eye went on to develop large drusen, and 71% of people developed a large drusen at their 10-year follow-up. In late advanced AMD, wet or dry type, many people notice that straight lines start to look wavy or crooked. That's where I'm at now. You may also notice a blurry area near the center of your vision. Over time, this blurry area may get bigger, or you may see blank spots or vision loss. Colors may also seem less bright than before, and you may have more trouble seeing in low lighting. When straight lines look wavy, it's a warning sign for late AMD. This stage leads to central vision loss. If you notice this symptom, please talk to your eye doctor right away. It's not too late to decrease the risk of severe vision loss with antioxidants. AREDS 2. Quote, when central vision loss begins, objects may appear distorted or blurry at first. In the late stage of the disease, objects in the middle of your line of vision cannot be seen at all. In the peripheral field, side vision, objects are usually still visible, but it might be difficult to figure out what they are. In the late stage of the disease, you may no longer be able to recognize faces. Although you may still have your side vision, you might be considered legally blind at that point. These are the symptoms of geographic atrophy. According to the CDC, in 2019, an estimated 10.8 million Americans aged 40 and older were living with AMD. Today, that number is about 20 million, or 12.6%. Of these, 1.49 million, or 0.94%, were living with vision-threatening late-stage dry AMD. And that also includes wet AMD. The prevalence of AMD increased with age from 2% among people aged 10 to 44 to 46.6% among people aged greater than 85. I'm only 64. It's the number one cause of vision loss for adults over age 50. The rate of AMD is lower for non-Hispanic Black people than for other racial and ethnic groups. If you are Caucasian, your likelihood is the highest. 90% of AMD cases are dry AMD. 30% of dry AMD patients will progress to GA. The risk of developing GA increases as dry AMD advances from early to intermediate with age, and there is some evidence that risk of GA also increases with certain risk factors. These are those risk factors. One of the strongest risk factors is poor visual acuity at baseline. A study found that patients with visual acuity at or worse than 20/200 had almost threefold greater risk of developing GA than those with a baseline of 20/25 or 20/40. Approximately 75% of people living with GA in the United States are believed to be undiagnosed. Wow. Without treatment, an estimated 66% of people with GA may become blind or severely visually impaired. And these are additional risk factors. When I read the information on Izervay, it certainly appeared to me that geographic atrophy is an autoimmune disease. Yeah, it's a chronic progressive disease, but when reading what Izervay does in the eye, I was convinced. But I can't find anything on the internet that says it's autoimmune. But on the literature that Izervay sent home with us and on their website, it reads that way. In people with GA, the immune system becomes overactive. A protein called C5 signals other proteins to start attacking retinal cells. Izervay blocks the C5 proteins to help protect healthy retinal cells and photoreceptors. On the website, Retinal Physician, the writer states, quote, Izervay injection targets the complement pathway. Specifically, it's a complement C5 inhibitor. There are more than 30 proteins in the complement system that are tasked with fighting infections. As a side note, continue with the quote. It limits the production of C5a and C5b, two fragments that may play important roles in cell death, cell lysis, and inflammation, unquote. It says Dr. Starr explained that. So it reduces inflammation and cell death associated with the development and progression of GA. This complement system is meant to protect our eyes, not damage it by attacking germs that infiltrate it. But when the complement system isn't working properly, that's exactly what happens. Quote, the membrane attack complex, or MAC, can start to attack the eye's own cells, which can lead to irreparable vision loss that becomes dry AMD and ultimately GA, unquote. Sounds autoimmune to me. The definition of autoimmunity, according to Britannica, is the state in which the immune system reacts against the body's own normal components, producing disease or functional changes, unquote. That sounds like what the researchers for Izervay believe is occurring in the eye, doesn't it? On their website, Iveric Bio, I think I said that right, and Astellas Company states it is committed to developing innovative therapies that address unmet needs of patients suffering from the progressive symptoms of common and rare retinal diseases. I appreciate that. That's the company that created Izervay. In a 2008 study, researchers stated, quote, it is hoped that in the future, recombinant complement regulatory proteins will be used as novel therapeutic agents in the clinic for the treatment of keratitis, uveitis, and age-related macular degeneration, unquote. And so they did. The clinical studies that Izervay slowed GA progression in just 1 year, there were 2 studies. In trial 1, there were 177 patients. The progression slowed by 35%. And in trial 2, There were 447 patients, and progression slowed by 18% in just 1 year. That's better than nothing, and will give me a lot more time. Less than 2% of people stop treatment due to side effects. In almost every clinical study, there are side effects. People stop because of those side effects. The most common side effect experienced at 12 months were the following. But these also happen in people who don't get the treatment with Izervay. So is the risk worth it? I think for me it is. But this would definitely need to be a personal choice. Avacincaptad, I have no idea if I said that one right, Pegol, intravitreal solution. So I put that here, which is the product name for Izervay, was approved by the US FDA in August of 2023 for the treatment of GA and is currently under review by the European Medicines Agency, or the EMA. So if you're in the European Union, you may be approved in the future. I wonder how long that will take. On the retinal physician website, the writer states, quote, on average, GA lesions can start to impact central vision within 2.5 years of diagnosis, unquote. Therefore, reducing and slowing lesion growth as early as possible is meaningful for patients like me, and I concur. Izervay is the only FDA-approved GA treatment that's been shown in 2 phase 3 clinical trials to significantly reduce the rate of GA progression after 12 months. And recently, the company announced that the second clinical trial slowed GA growth over 24 months. It was statistically significant compared to the sham treatments, so that's pretty cool. As of October 31, 2023, 12,000 vials of Izervay were distributed to physician practitioners, clinical trials, and sample vials. That was Lucy. There's a need, and they are meeting that need. So avacincaptad pegol is an RNA aptamer. In the phase 3 clinical trial, patients were aged greater than 50, had a GA lesion area between 2.5 and 17.5 millimeters. The lesion area was measured at baseline and every 6 months for the duration of the trial, approximately 18 months. Patients were randomized between groups, meaning they didn't choose whether they got the sham treatment or the real vial. Researchers checked for efficacy and the mean change in GA lesions. A statistically significant reduction in GA was still evident after 18 months of treatment, and patients had a lower decline in visual acuity than patients in the sham group. Vision acuity is the clarity of vision that we have. So how clear we can see objects. With a surge of global AMD populations, which is estimated to reach 288 million individuals by 2040, this new treatment is a step in the right direction. It signifies a transformative chapter in GA management, addressing the unmet need for GA-specific interventions. I do hope that research finds drusen-busting treatments that target the lipids. And of course, a good diet is important for prevention. If you have a family history of AMD, you should work with an eye care specialist to establish a routine of thorough eye exams. At age 40, it's recommended that everyone have a complete dilated pupil eye exam to establish a baseline for eye health. And I've been getting regular eye checkups since my early 20s, but thorough dilated pupils since my late 40s. I've been on eye vitamins since about my early mid-50s, at least, maybe before that, but I wish I had started earlier. Lutein and zeaxanthin. I don't know. Right here. 2 essential nutrients found naturally in the back of the eye help promote eye health, along with omega-3s as a fatty acid. Their omega-3s are important structural components of the retina. We need vitamin C and E for their antioxidant protection, and zinc is found in a high concentration in the retina. It helps regulate immune function in our eyes and protects the retina and cell membranes and protein structure of our lens. However, some patients with intermediate to advanced AMD may do better without zinc. I'm not sure. I think you should follow your doctor's advice. Multivitamins are not enough to care for our eyes. Eye vitamins give us more of the essential nutrients that are needed for eye health. It's not too late for you to start taking eye vitamins and eat lots of those healthy leafy greens. And if you smoke, stop smoking. I hope this all made sense to you. I send you gentle hugs and support. Love you. The macula is less than 1/4 inch. The macula is less than 1/4 inches wide. And will to decrease, but when we're on their website, Iveric, we come avacincaptid, zeaxanthin, that